Esophagitis. Why won't your reflux symptoms go away? Imagine feeling a burning sensation in your chest that just won't quit, even after trying all the usual remedies. That persistent discomfort might be more than just simple indigestion. It could be esophagitis, which is inflammation of the lining of your esophagus. This condition often keeps reflux symptoms lingering despite treatment. When stomach acid and other gastric contents repeatedly flow back into the esophagus, they cause irritation and damage to the tissue. This ongoing exposure leads to inflammation, which can cause pain, difficulty swallowing, and a burning feeling that just won't go away quickly. There are several reasons why reflux symptoms and esophagitis might stick around. First, the esophagus has natural defenses like muscle contractions that help clear acid, saliva that neutralizes it, and mucus that protects the lining. If these defenses are weakened or not working properly, acid stays longer in the esophagus, causing more damage. This is common in people with gastroesophageal reflux disease, or GERD, where the esophageal muscles don't work as they should. Another key factor is the lower esophageal sphincter, or LES. This is a muscle that acts like a valve, stopping stomach contents from refluxing. If the LES relaxes too often or has low resting pressure, acid can flow back more frequently and severely, worsening esophagitis. Conditions like a hiatus hernia or increased abdominal pressure from obesity or pregnancy can also disrupt the normal function of the LES, making reflux worse and harder to control. Lifestyle choices matter too. Drinking alcohol, smoking, lying down right after big meals, or taking certain medications can lower LES pressure or directly irritate the esophagus. Stress is another factor that can increase acid production and impair the LES, making symptoms more persistent. Chronic inflammation from esophagitis can lead to complications like ulcers, strictures, or even Barrett's esophagus, which is a change in the esophageal tissue that can increase the risk of cancer. Treating esophagitis effectively involves more than just reducing acid with medications like proton pump inhibitors. It also means improving how the esophagus clears acid, managing lifestyle habits, and sometimes addressing anatomical issues like a hiatus hernia through surgery. Managing stress and avoiding behaviors that worsen reflux are also important steps. If your reflux symptoms keep coming back despite treatment, it's often because the esophagus remains inflamed and damaged. The ongoing acid exposure and impaired defenses keep the cycle going. To help symptoms improve, you need a comprehensive approach that targets both reducing acid and healing the esophageal tissue. This way, you give your esophagus the best chance to recover and stop the discomfort from sticking around.